Staging peritoneal mesothelioma. Peritoneal mesothelioma is a type of malignant cancer that is caused by ingested asbestos fibers. It develops in the peritoneum, the thin layer of tissue lining the abdomen. Symptoms of peritoneal mesothelioma include abdominal pain, nausea and swelling in the abdomen, ascites. What is peritoneal mesothelioma? Peritoneal mesothelioma is a rare asbestos-related cancer of the abdomen. This cancer forms on the abdominal lining, which is known as the peritoneum. Doctors diagnose about 600 cases of peritoneal mesothelioma in the United States each year. Peritoneal mesothelioma symptoms are usually broad and similar to those of many other illnesses. General practitioners often misdiagnose peritoneal mesothelioma as a less severe abdominal condition. Confirming an accurate diagnosis typically requires a history of asbestos exposure and a tissue sample known as a biopsy. Quick facts about peritoneal mesothelioma. The peritoneum lines the abdominal cavity and carries blood vessels and nerves to abdominal organs while also providing structural support. A rarer form of this cancer develops in the omentum, a layer of the abdominal membrane covering the stomach and other organs. Early symptoms include abdominal distension and fluid buildup known as ascites. Peritoneal mesothelioma accounts for less than 20% of all mesothelioma cases. The average life expectancy of peritoneal mesothelioma patients is 12 months. Surgery with heated chemotherapy is the most effective treatment, and some patients survive for more than 5 years. Clinical trials are available for peritoneal mesothelioma and include new treatments such as immunotherapy. The primary cause of peritoneal mesothelioma is swallowing airborne asbestos fibers or drinking contaminated water. The digested fibers become trapped in the peritoneum. What are the symptoms of peritoneal mesothelioma cancer? Early symptoms of peritoneal mesothelioma include bloating, pain or tenderness around the abdomen, and digestion issues such as constipation or diarrhea. These symptoms tend to mimic many other abdominal disorders. An accurate diagnosis often requires a mesothelioma specialist. Anyone with a history of asbestos exposure should monitor their health and see their doctor for any new or worsening symptoms. Peritoneal mesothelioma symptoms include abdominal pain, abdominal swelling, ascites, night sweats, nausea, fever, unexplained weight loss, fatigue, diarrhea, constipation, loss of appetite. What causes peritoneal mesothelioma? Ingesting asbestos fibers causes malignant peritoneal mesothelioma. Exposure can occur from swallowing airborne fibers or swallowing water contaminated with asbestos. Current research suggests that asbestos fibers travel from the digestive tract and remain trapped in the abdomen, causing cancer after years of inflammation. The steps of peritoneal mesothelioma development include: swallowed asbestos fibers pass through the stomach and digestive system. Ingested asbestos fibers reach the lymphatic system and travel to the peritoneum. Once fibers are in the peritoneum, they irritate cells and damage DNA over many years. The irritated cells become inflamed, form scar tissue and thicken the peritoneal lining. Years of inflammation and scar tissue formation cause excess abdominal fluid buildup. After prolonged damage, malignant tumors begin to form on the diseased peritoneum. As tumors grow, they put pressure on vital organs and can spread to form new tumors. Research on peritoneal mesothelioma is still ongoing. Other sources of this disease may include abdominal radiation and fibrous minerals besides asbestos, such as irainite. How is peritoneal mesothelioma diagnosed? Abdominal mesothelioma is diagnosed with imaging scans, blood tests and biopsies. Imaging scans show the size and location of tumors. Blood tests reveal certain biomarkers associated with cancer. Biopsies show what kind of cancerous cells are present. patients will also receive a thorough examination of their medical history, occupational history and overall physical condition. While every test serves a contributing purpose to the diagnostic process, the only way to confirm a peritoneal mesothelioma diagnosis is with a biopsy. Biopsies are samples of tumor tissue that doctors examine under a microscope in a lab. Medical professionals, called pathologists, perform tests on the biopsy sample to reveal the kinds of cancerous cells within the tumors. They then summarize the results in a pathology report. Diagnosing cell types of peritoneal mesothelioma. The pathology report contains information about which cellular subtype of peritoneal mesothelioma you have. Common cell types. Epithelial cells are the most common, making up 75% of cases. The basic type, which is a combination of epithelial and sarcomatoid cells, is the second most common. It comprises about 25% of cases. Epithelial peritoneal mesothelioma can grow in 4 different patterns: papillary, tubular, diffuse and deciduous. Papillary is the most common and often appears alongside the others. Pure sarcomatoid tumors are uncommon in peritoneal mesothelioma. Specialists have only diagnosed about 30 cases of this variant since 2006. Sarcomatoid cells usually occur alongside epithelial cells to form the basic subtype. Rare cell types. Well-differentiated papillary mesothelioma, multicystic mesothelioma, desmoplastic mesothelioma, lymphohistiocytoid mesothelioma, pure sarcomatoid mesothelioma. Additionally, omental mesothelioma is a rare variant that forms in the omentum, a part of the peritoneum surrounding the stomach and other abdominal organs. Misdiagnosis. Because this cancer is rare, doctors lacking experience with the disease often misdiagnose abdominal mesothelioma patients with more common illnesses that share similar symptoms. Peritoneal mesothelioma misdiagnosis can delay proper treatment. If you have a history of asbestos exposure, the best way to ensure an accurate diagnosis is to schedule an appointment with a mesothelioma specialist. Doctors who specialize in peritoneal mesothelioma have the knowledge and tools needed to make a precise diagnosis. Peritoneal mesothelioma staging. There is no official staging system for peritoneal mesothelioma. Instead, peritoneal mesothelioma experts spent decades adapting other staging systems for their use. Historically, the TNM staging system used in other cancers has not been a good fit for peritoneal mesothelioma due to the diffuse pattern of growth. However, a research report in 2020 suggested that oncologists could adapt the TNM system for peritoneal mesothelioma into 3 stages. 3 stages of peritoneal mesothelioma. Stage 1, cancerous tissue is minimal, tumors are only within the abdominal lining and lymph nodes are free of cancer. Stage 2, cancerous tissue is moderate and tumors have not spread outside the lining or into lymph nodes. Stage 3, cancerous tissue is more extensive and tumors may have spread outside the peritoneal lining or into lymph nodes. There is no precise 4th stage in the adapted TNM system for peritoneal mesothelioma. Many doctors consider stage 4 to involve extensive tumors that have spread to distant sites throughout the body. Peritoneal Cancer Index. The Peritoneal Cancer Index is a diagnostic tool that doctors use to assess the location and spread of tumors on the peritoneum. It helps them determine the approximate mesothelioma stage and appropriate treatments. The index divides the abdomen into 13 parts. Doctors assign a number, 1 to 3, to each area based upon the most sizable tumor in that area. The Peritoneal Cancer Index score is the sum of the individual scores from the 13 regions. A patient's maximum score is 39, 13 times 3. Lower index scores mean the patient may qualify for surgery. Index scores above 20 indicate cancer has spread too far and that the patient likely won't respond well to surgery. Peritoneal mesothelioma treatment options. The most effective peritoneal mesothelioma treatment option is surgery with heated chemotherapy, also known as hypothermic intraperitoneal chemotherapy, or HIPEC. However, chemotherapy alone is the most commonly used treatment for peritoneal mesothelioma. More than 60% of patients are ineligible for surgery with heated chemotherapy due to the procedure's intensity. Cytoreductive surgery can take several hours and may involve removing large portions of the intestines or whole organs. Cytoreductive surgery with heated chemotherapy. Cytoreductive surgery, also known as a peritonectomy, attempts to remove as much cancer as possible. Then, heated chemotherapy is applied locally to the abdomen before the surgery ends. Doctors only perform this procedure on a case-by-case basis. A 2019 study reported that more than 65% of the patients who underwent this procedure lived 5 years or longer. Chemotherapy. Patients who don't qualify for surgery with heated chemotherapy can receive systemic chemotherapy alone. Chemotherapy drugs can shrink peritoneal mesothelioma tumors and slow the growth and spread of cancer. Chemotherapy drugs that are effective against peritoneal mesothelioma include pemetrexed, cisplatin, carboplatin and gemcitabine. U.S. Navy pilot and peritoneal mesothelioma survivor Jim Madaris decided to seek out the HIPEC procedure after his diagnosis in 2013. The surgery took 14 hours and removed his gallbladder, spleen and parts of his intestine. Madaris extended his life by 4 years, allowing him to find joy in the little things and see his youngest child graduate high school. Palliative treatment options. In addition to anti-cancer treatments, many peritoneal patients receive palliative care to control symptoms and improve quality of life. For example, a paracentesis procedure may be recommended to certain peritoneal patients to drain excess fluid from the abdomen. A palliative care specialist prescribes medications to control pain and side effects. They may refer patients to physical or occupational therapy or recommend complementary therapies. Peritoneal mesothelioma life expectancy and prognosis. The prognosis for peritoneal mesothelioma is generally poor for patients who don't qualify for surgery. Peritoneal mesothelioma life expectancy is approximately 12 months for patients who receive chemotherapy alone. The median survival of untreated peritoneal mesothelioma patients is 6 months. However, the prognosis for surgical candidates is significantly better. Surgery and heated chemotherapy can improve peritoneal survival by several years. About half of peritoneal patients who undergo a combination of cytoreductive surgery with heated chemotherapy have a life expectancy of more than 5 years. According to a 2020 study published in the American Journal of Surgical Pathology, women with peritoneal mesothelioma tend to live longer than men. In the study, 77.8% of women treated with cytoreductive surgery and heated chemotherapy at MD Anderson Cancer Center in Houston survived longer than 5 years. When averaging short and long-term survival, women live approximately 13 months on average, and men live roughly 6 months. Prognostic factors. Stage at diagnosis. Cell type. Tumor grade. How fast it grows? Gender. Genetic mutations. Treatments selected. Patients with tumors containing epithelial cells have a longer life expectancy than patients with sarcomatoid or phasic cells. Epithelial cells tend to respond better to treatments such as chemotherapy. The tumor's grade also impacts prognosis. Tumor grade indicates how quickly tumors are likely to grow and spread, based upon how abnormal the cells appear. Chemotherapy survival rates. Systemic, whole body, chemotherapy combined with cisplatin and pemetrexed has the following benefits. A response rate of about 30%. Average progression-free survival around 11.5 months. Median survival around 13 months. Chemotherapy delivered directly to the peritoneum without surgery has a higher response rate of 47%. When combined with heated chemotherapy given during surgery, the response rate is 84.6%. Is there a cure for peritoneal mesothelioma? There is no cure for peritoneal mesothelioma or any other type of mesothelioma. However, peritoneal patients eligible for surgery in HIPEC typically live longer than 5 years. Some patients may be eligible for a repeat surgery with heated chemotherapy if a mesothelioma recurrence happens. In 2017, Dr. Paul Sugarbaker reported improved survival among patients who received early post-operative chemotherapy and long-term chemotherapy after cytoreductive surgery with heated chemotherapy. Of the 29 patients who had surgery with HIPEC, post-operative chemotherapy and long-term chemotherapy, 75% lived longer than 5 years. No patients in the study received intravenous or systemic chemotherapy. Feelings of depression or loneliness are common among peritoneal mesothelioma patients. Support services such as counselors and support groups are available. Talking to a counselor or joining a support group can help improve quality of life. Common questions about peritoneal mesothelioma. What are the symptoms of peritoneal mesothelioma? The symptoms of peritoneal mesothelioma include abdominal pain, abdominal swelling or distension, diarrhea or constipation, weight loss and fatigue. Other symptoms may develop as the disease progresses, such as fever and night sweats. Is peritoneal mesothelioma curable? Peritoneal mesothelioma is incurable at all 4 stages. Clinical trials are searching for a cure by testing new treatments including immunotherapy and multimodal therapy. How long do peritoneal mesothelioma patients live? Peritoneal mesothelioma patients have a life expectancy of about 1 year. However, survival is significantly better for patients who qualify for surgery with heated chemotherapy. Half of the patients who qualify for this procedure live at least 5 years.